Let's get rid of that cough today. A cough is a reflex that occurs in response to irritation in the throat or lungs. It is simply the body's way of removing irritants. Irritants can be dust, it can be smoke, it can be chemical fumes or air pollutants. It can also be allergens like molds. So cough is just simply the body trying to remove those irritants. It is important you know the nature of your cough to know the best way to approach the treatment for your cough. Now we have dry cough and wet cough, but today we are going to be focusing on wet cough. Most people can't tell the difference between wet cough and dry cough. Now, wet cough, also known as productive cough, is a cough that produces mucus or phlegm. And there's something tricky about wet cough. There's this kind of wet cough when there is a mucus in your throat, but it is not coming out. You just have that feeling that something is stuck in your throat. It always makes that sound of grr, grr. You hear this grr sound when you are coughing, but that mucus is not just coming out. That's where we talk of expectorant. In the treatment of wet cough, the major aim is to clear the airways. That's where expectorant comes in. Expectorants helps to thin and loosen mucus in your airways to cough it up more easily. Now, expectorants works by adding water into the mucus to make it easily breakable so that you can cough it up more easily. Expectorants are not used in treatment of dry cough. Expectorants are only used in the treatment of wet cough. Take note of this. Expectorants, they help break up chest congestion, which is caused by common cold, flu, pneumonia, bronchitis. Expectorants treat the symptoms and not the underlying cause. In cases where your cough is caused by an infection, expectorants doesn't make the infections go away. That is where we introduce antibiotics in the treatment of your wet cough. Now, examples of these expectorants includes your guaifenesin. That's a good expectorant. It comes in tablets or in liquid form. We have potassium iodide. That one is majorly under prescription and is always used in chronic lung disease. Comes in liquid form also. We have the hypertonic saline solution. That's also used in nebulizers. It is just higher in salt than the normal saline solution. We have the ammonium chloride, the sodium citrate, always used in combination with the ammonium chloride. So in your treatment of wet cough, you see these active ingredients in your cough medication to identify that, yes, these are the expectorants needed for the treatment of your wet cough. So side effects of these expectorants, well, it depends on the particular expectorant, but generally you experience nausea, vomiting, headache in some cases. As for potassium iodide, the notable side effect is a metallic taste. So when you have a metallic taste, don't panic. Do like this. It's just a side effect. So, but always speak with your healthcare provider before taking any medication. Chisom, I want you to keep in mind that medicine doesn't affect everyone the same way. So yeah, your friend for me said, I use this cough medication and then it worked for me. That doesn't mean you should go ahead and use it. Always speak with your healthcare provider to determine what works best for you. Your healthcare provider, be it your doctor or your pharmacist, will review these cough medications and know what you should take. Well, I believe that with all these expectorants I mentioned, you should be familiar with the active ingredients to look out for when you want to treat a wet cough. So after treatment, if symptoms persist or you're not getting any better, even you're getting worse, kindly call your healthcare provider. Speak to your doctor, speak to your pharmacist. And if you are experiencing difficulty in breathing, please speak to your healthcare provider. So, Ebuka, it's not anytime you have cough. You remember that cough syrup that you left on your shelf ages ago. You now rush and go and gulp it. I even noticed that some of you gulp cough syrup. No, please. And there's dose for everything. If you want to know the dose, ask your pharmacist, ask your doctor for the dose. Not just the gulp. I'm like saying a desperado. Ebuka, you too like shy. Don't gulp it. So ask for the right dose, please. So if you find this video helpful, do well to like and repost so that others can see it too. Of course, I remain your celebrity pharmacist, Pharm Super.